Okay, next we're going to do a hot whirlpool. In the hot whirlpool, this is going to be used for chronic injuries. Usually works good for the extremities, either the foot, knee, leg, or arms. In this case, we're going to say that she has strained her forearm muscles. So for this treatment, and it happened several weeks ago, so it's chronic. So we want to make sure that we inspect the area to make sure it's she has the indications for the hot whirlpool. We also want to make sure, or if we're doing cold whirlpool, this can be hot or cold. We want to make sure that she is does not have any contraindications for it. So since this is an acute injury, would be an contraindication for the hot whirlpool. So what we need is our whirlpool. We're going to get 2 towels. We have our patient chart, and we have our timer to set for during the treatment. Next, we want to make sure that right now when we close the whirlpool on this machine, make sure that you check each machine. They might be a little bit different. This machine, to close it, the lever for that is over there to the side. And then we can start filling it again with our hot water. Typically for the hot whirlpool, this is going to be anywhere between, for an upper extremity, between 98 degrees and 110 degrees. For a lower extremity, it's going to be a little bit lower, anywhere from 98 degrees to 104 degrees. If you're given a full body treatment, then it's going to be even lower, 98 to 100, no more than 102 degrees. When we fill the whirlpool up, we want to make sure that the water goes above, a couple inches above at least the bottom of the turbine, this unit here at the bottom of that. Right now it's about a few inches from the bottom. We need to make sure it goes over the top of that at a minimum, so that it doesn't burn out or cause any other damage. So we can also watch the temperature on the temperature gauge here. As we can see, it's currently at about 106 degrees. So another thing that we wanted to get, because in this case we're going to be doing an upper extremity treatment, we want to get a padding, some type of a padding. In this case I use towels for the edge of the pool to make it a little bit more comfortable. We also got a chair for her, and then we got a second towel for her to dry the extremity when she pulls it out. This is one of those modalities where the patient, it can be a little bit dangerous for the patient. We want to make sure that the patients are not touching any of the controls themselves to get electrocuted. You want to make sure that the electrical outlets are ground faulted, GFI indicators, GFI, or the system that you're using, the electrical system is GFI. But again, make sure you instruct the patient, not to turn the machine off, not to turn the machine on. Make sure that the athletic trainer or therapist is doing that for the patient, and just again for safety reasons and liability. Again, if you're doing a cold treatment and the water is not getting cold enough, you can always use ice from the ice machine. Or from ice bag treatments, if you have some leftover ice bags or ice cups from other cryotherapy treatments. Okay, so once this gets about, at least 4 to 6 inches above the top of the turbine, again, the top of it, not the bottom of it, and we'll make sure that our water temperature is not too hot. Again, another way to test it or to get the water circulating a little bit. So once we turn the turbine on, we can check the water to make sure that it's at the temperature that you need it, and then turn the water off. Okay, and then once we have the unit turned on, we can also ask the patient to put her hand back in the water, and again she can lean up against the towel or double it up if she needs to. We can also adjust by turning it here, and if it's stuck, the height, we can raise it and lower it if we need to. And again, depending on the treatment, you may want the jets to be flowing right at the injured body part, and in some cases you may want the jet to flow away from the body part. You can also adjust the pressure of the turbine flow by adjusting this one knob here. So there we have a lot of bubbles flowing out, and here we have a stream of bubbles flowing out. So and again, we would have set the timer for about 20 minutes. And then at the end of the 20 minutes, we'll turn it off for the patient and have her pull it out. And again, she can dry it on the dry towel. And you can inspect it and record it, the treatment, and tell her when to report back again for the next treatment. You also want to drain the Whirlpool. Okay. So again, for this one, we'll just lift it up and you want to make sure that you are cleaning the Whirlpools, at least, if not after every treatment, at least at the end of the day, or whatever your facility recommends. So you also want to make sure that you check all the outlets and everything to make sure that there aren't any problems. And that is it for the hot Whirlpool treatment.